Retinoblastoma is a rare cancer, but is the most common paediatric eye cancer. It can be heritable, so passed on from an affected parent into their children. However, it can also occur spontaneously, and 90% of children that are diagnosed with retinoblastoma have no family history. The signs that we often see first is something called leukocoria, or a whitening of the pupil, the black part in the center of the eye, or a loss of the usual red reflection that you see on flash photography. And the other most common presenting sign is something called strabismus, which is where there is a turn of the eye either inwards or outwards. So if you do see any of these signs in your child or in a family member or friend, please get them to see an ophthalmologist as soon as possible.
When my wife was pregnant, we discovered that Zoe had carried a gene mutation, putting her at risk of retinoblastoma. I remember we were shell-shocked. When she was around 4 weeks old, Dr. Ben detected a tumor in her eye that's less than 1 millimeter in size. And true enough, Zoe recovered very fast, and within a few days, she was pretty much back to her usual self.
It's so wonderful to see Zoe thriving, and how interactive she is with the world is really, really gratifying. And knowing that because she was able to be detected so early and have good treatment, that she's going to have really good visual outcomes, and that we'll continue to screen it. If anything else crops up, I'm confident that we'll be able to get on top of it really early, so she can live a happy and healthy life. Intraarterial chemotherapy involves delivery of chemotherapy agents in a local way, so that it's affecting the tissues of the eye where we see the retinoblastoma tumour. Intraarterial chemotherapy is something that we're providing in Western Australia for the first time, and we performed our first case of this in April of this year. Prior to the first case being done at Perth Children's Hospital this year, the community of Western Australia and kids affected with retinoblastoma would have to travel across the Nullarbor to Sydney or Melbourne to access intraarterial chemotherapy. This means that they would have to travel every 3 or 4 weeks for at least 3 or 4 months to have successful treatment. That is a huge treatment burden. So much so that there are many cases where families would not be able to handle that treatment burden and instead elected for the enucleation or removal of the eye to cure the disease, rather than to have the treatment that could potentially have saved the eye and saved vision. So this is really an equity of access issue for the WA community, and I'm really pleased that we can now offer it to WA families.
She's very playful, curious now. As you can see, her personality is coming through, and that all thanks to the successful treatment.